We're talking about blood vessels. The four kinds are the capillary, the artery, the vein, and the largest of all, the human heart. These are the four kinds of blood vessels in the body. All kinds of blood vessels. Let us start off with something that we all know, something we can feel. And if you go to the wrist, where you have an artery on the radial side of the wrist, where your thumb is, below the thumb, you can feel your pulse. This is a pressure wave in the radial artery, just there, the radial artery. And what we are doing is feeling the wall of the artery. And it is elastic. Only when we're very, very old and the artery is sclerosed will we find that it doesn't bend under our fingers. It feels like a pipe, like a lead pipe, because it has become stirred up with calcium. That is an indication for very sensitive people of arteriosclerosis, where the blood vessels are hard and rigid, and no longer soft and pliable. And so we get the concept then of an artery. And an artery we can draw like this. It has thick walls, very, very thick walls. And the walls are made up of 3 layers. Don't have to know the names of the layers, not because I don't know them. Tunica intima, tunica media, and tunica, well, the outside one, externa. And in the walls of the arteries there are 2 very important materials. One of the materials is muscle fibers in the walls of the arteries. Muscle. The other material, equally important, is elastic, pieces of elastic. So in the walls of the arteries we have elastic and we have muscle. The elastic means that the wall is constantly rebounding against the tension exerted on it. And if we put blood into it, it will constantly press back on the blood. It's elastic. This has a very important function in the body. It maintains the pressure of the blood. It maintains the pressure of the blood, or helps to maintain the pressure of the blood. And imagine what would happen if the heart pumped blood into a metal tube. The blood would go in and it would disperse. There would be no pressure at all. It was either full or empty. But if you pump blood into an elastic tube, the elastic will constantly squeeze on the blood, maintaining its pressure. And blood must be under pressure in order for the cells to get their adequate oxygen from it. Blood must be under pressure. Otherwise, the tissues will be starved of oxygen, which is what we call anoxia. Anoxia, no oxygen. So this is the characteristic of an artery. Notice the walls are so thick that oxygen or any gas can't get through them. An artery merely conducts blood under pressure. It doesn't let the air out, just conducts the blood under pressure. What we can do here is to put inside the lumen of the artery, we can put the blood in. There you are. And that's a typical artery. So, let us now do a side drawing and put our artery in. The artery gets smaller and smaller as it gets to the periphery of the body. Starts off at the heart as a huge artery, and as it goes to the tip of the finger, the arteries and the tips of the fingers are tiny. So the artery gets smaller and smaller. It's the blood highway of the body, and all the time it's giving branches out here and there and so on, getting smaller and smaller. What happens to it? Does it just fade away in the tissues? It ends in what we call a capillary. It ends in a capillary. All arteries end in capillaries. All arteries end in the capillaries. Let me draw a typical artery ending in a capillary. Here's the artery, and it breaks up into what we call capillaries, branches. There they are. A capillary network, we would call it. So the artery comes to an end, and it is only in the capillaries that it releases its oxygen. Only in the capillaries, which are tiny, is the oxygen able to leave. There's the oxygen in the red cells, and it leaves the blood vessels in capillaries. So this is a capillary bed. Capillary bed. Before we go on to describe the arteries and capillaries further, let's take the story up. What happens as oxygen leaves red blood? The blood goes brown. When blood loses oxygen, it turns brown. Seen through the thin walls of veins, it looks blue. So as the blood loses its oxygen in the capillaries, where's the oxygen going? To all the cells here. This might be, for instance, a capillary bed wrapped around the root of a hair. There's a hair, your scalp. Wrapped around the cells of the hair is this capillary network. So this capillary bed is giving oxygen to the root of this hair, cells in the root of the hair. As it does so, if you watch the board very carefully now, as it does so, the capillaries change color. Blood has gone brown, and through the walls of the resulting blood vessels, blood looks blue. This happens at the end of every artery. So we can now say that all veins begin with capillaries. So a vein begins with a capillary, and an artery ends with a capillary. Now you can see the way in which the body functions. Oxygen in the red cells, here they are. Oxygen in the red cells comes down under pressure, the walls inside the arteries, and then the artery breaks up into tiny little thin capillaries. The oxygen leaves the red blood. Blood becomes deoxygenated, turns blue or brown if you like, and flows back to the heart, now lacking oxygen in what we call veins. Now, if that is an artery, a vein, veins usually travel with the arteries. The veins are much thinner in their walls. There's a vein. A vein has a very, very thin wall. There's a vein. Has practically no elastic in it, practically no muscle. It's just a tube that can be any thickness, as it were. Now, a very important matter which I have not mentioned. The purpose of the muscle in the artery is for two things. Maintain the pressure, like I said, and the second thing is to enable it to dilate or constrict. The artery can become wider, enlarged, or reduced. In other words, the body can decide how wide its arteries should be. The sympathetic nervous system makes the arteries narrow or constricted. The parasympathetic nervous system counteracts this and allows the arteries to become dilated. When we go red in the face, it's because arteries and capillaries have dilated in our cheeks. The red blood is flowing through these widened capillaries and arteries. So the function of muscle on the wall of an artery is either to constrict it or to open it. Therefore, one of the things necessary in healing is to stimulate the opening of the arteries, dilatation of the arteries wherever possible. Because if you can get a better blood supply, you can get more oxygen to the tissue, you can get more healing materials to the tissue, vitamins to the tissue, sugar to the tissue, whatever it needs, if you can improve its blood supply. So we have considered something of the blood vessels of the body. The capillaries are so thin-walled that they have virtually only one cell in their walls. I'm drawing on the board now a typical capillary. There is its opening at the top. It's made up of single cells. Can you see that? You all understand what I'm doing here. What I'm drawing here is a capillary with a single layer of cells around it. Not many like an artery with cell after cell in the walls, but just a single cell. Can you understand that on the blackboard? It's important to understand it because these capillaries are so small that you need a magnifying glass to be able to see them. You can see them in your fingernails, just below the quick, and in places like that, in the eyelid, so on. Now, they're so small that only one or two or three, perhaps, red cells can move through them with the serum, of course, the plasma. Let's put plasma in. And so here is a typical capillary with blood passing through it. And it's the smallest of the blood vessels. Now, the cells in the wall of the capillary are attached to each other by what we call a cell cement. A cell cement anchors them to each other. But the cell cement is deficient. There are gaps in it. So what happens is that through the spaces between these cells, oxygen emerges. Oxygen comes out. Oxygen inside the red cells leaves the capillaries, and it goes to the kidney cells or the liver cells, whatever happen to be lying around. The oxygen leaves the red cells through spaces in the walls and goes into these tissues. And that is how gases are exchanged. In return, carbon dioxide exhaust fumes, as it were, pass into the blood. So the blood gives out oxygen and at the same time picks up carbon dioxide. And that is its main transportation function. And this only occurs in the capillaries. Now we can begin to put together what we might call the circulation of the body. Circulation of the blood, I should say. The circulation of the blood. Let us take, for instance, the circulation in your body. I'm going to put the heart in like that. Leave it a blank, more or less. Talk about the heart in a moment. Well, circulation in your body amounts to the following. From your legs, venous blood, blood in the veins, moves upwards in big veins towards the heart. So from the legs, from the pelvis, from the kidneys, from the liver, the blood moves up, joining an ever-increasing size of vein known as the inferior vena cava, the inferior vena cava. Blood moves upwards. All the time it's being fed with more and more veins from pancreas, intestine, on. Eventually it pours into the heart. Now you can all understand that, how the lower part of the body has the blood removed, drained from it towards the heart. It's going to the heart because the heart is going to send it into the lungs. Similarly, blood from the brain, from the face, from the neck, and from the arms also moves towards the heart. And we have veins for all of this. A great big vein called the superior vena cava, the SVC, draws the blood from the head and upper trunk to the heart. That represents the venous part of the blood system, the venous part of the blood circulation. Now what happens in the heart is this. The heart is a blood vessel. It has been elaborated out of a tube, just like a great big artery. What happened was that this tube was a great big artery with lots of muscle around its walls, changed in shape, as it were, like that, and certain embryological changes brought about a bringing of these two loops of the tube together to fashion what we call the human heart. You don't have to go into that here. Now the heart is a blood vessel and it's a pump. First thing that it would do then, from the right side of the heart where all the venous blood, it shunts the blood towards the lungs. Shunts the blood towards the lungs. And we might as well then very quickly put in two lungs here. There's one and there's the other one. Very narrow little lungs, but let's put them in. So the region of the lungs, the pulmonary vessels divide and they branch into the lungs like that. Now in the lungs, oxygen is present in vast quantities. The result is that the carbon dioxide leaves the veins in the lungs and oxygen takes its place. There's what we call gas exchange. And the blood in the lungs turns bright red, because at the end of every vein inside the lungs there is a capillary network that's going on all over the lungs. And as the blue blood is presented with oxygen in the lungs, it changes its color, absorbs the oxygen, and comes out red again. That goes on inside the lungs the whole time. Millions and millions of capillaries bring in the blue blood, the deoxygenated blood. Air enters the blood changes to bright red. When it is oxygenated, it is led away through two pulmonary vessels back to the left side of the heart. Next thing is for the blood to leave the heart and to travel round the body. Some of it will go up to the head, some of it into the arms, and the rest will go down to the trunk. Come to the kidney, come to the liver, intestines, pelvis, legs. There, the arteries will break into millions of capillaries. The capillaries will release the oxygen to the kidneys, the liver, to the legs, pelvis, the sexual organs, whatever they are, and so on. And there, the oxygen will be given to these organs, carbon dioxide will be taken in, the blood changes color, moves back to the heart. Now there is a system which is known as the lung or pulmonary circulation. I'll go into it in a moment. And this is the systemic circulation. Let me very quickly have heart, and then it goes to the lungs. We have the pulmonary circulation. Systemic, pulmonary, systemic, pulmonary, systemic, pulmonary. Pulmonary circulation is calculated merely to oxygenate the blood. That's the pulmonary circulation. The systemic circulation is calculated to deliver oxygen to all the tissues of the body. So the heart is a sort of meeting ground of these two circulations, one that goes into the lungs, the one that goes round the body. And we could then, very beautifully, shall we say, put in circulation system. Here is veins of the brain and the head coming away, and they pass. I've got it round the wrong way this time, haven't I? I'd better put it that way. Here is blood from the brain, joined by blood coming from the arm, coming down into the heart. Do you understand that? You could put here arterial blood being delivered to them. A conception first. We have got the blood leaving the heart, going to the brain, going to the, so we should put it this side, going to the arms, like that, going to the liver, kidney, pelvis, leg. They're changing colour, it loses its oxygen, and moving upwards again towards the heart, joined by the upper trunk. So we have the heart here. Now, do you all understand what we mean by the pulmonary and the systemic? I have just drawn the systemic circulation there. I'll put the pulmonary circulation in here. There's the heart. Pulmonary circulation. Here comes a blood vessel from the heart, dividing into two, going to right and left lungs, and inside the lungs in millions of capillaries. Blood is presented to the air and it changes colour, comes back to the right side of the heart. Can you understand that? That's the pulmonary circulation. You need to understand these before we, in fact, do the heart itself. Now let's consider the heart. The quickest way to look at the heart is immediately to divide it into four chambers. There you are. We'll draw a circle and we'll divide it into four. We'll say that's our rudimentary heart. Four chambers. We call this one the right side of the heart, therefore the right atrium and the right ventricle. Call this the left atrium, the left ventricle. Four very important heart chambers. Now we can go back. I'd much rather you just followed this so that you could get the hang of it from me. In comes the blood. Watch very carefully. In comes the blood from the trunk and from the head and upper limb there. And it pours into the right atrium, the blood vessel, blood chamber in that vessel. Then the next thing that happens is that a valve opens here. We're going to come back to it. A valve opens there and allows the blood to go into the right ventricle. There it is. Next thing is that ventricle contracts and this blood shoots out of the ventricle in a pulmonary artery, the only artery in the body that carries blue blood, towards the lungs. Next thing that happens is that the red blood coming back from the lungs, this becomes oxygenated, red blood coming back from the lungs enters the left atrium. From there it is pumped into the left ventricle, and from the left ventricle it is pumped out under great pressure all parts of the body. That is taking you now more closely towards the heart itself. Now we can go to a a large drawing of the heart. We can put in, as it were, a little more detail than we had before. A bit more detail than we had before. Going to have to do that. Now there are your 4 chambers again. Instead of them being in a perfect circle, we've now given them a bit more shape. So we can say then that through a gap here, blood comes into the heart from the venous system, from the veins, comes into the right atrium, and then muscles in the wall of the right atrium, there they are, contract, squeeze the blood here, contracts this chamber. Immediately that happens, it forces a valve open. There's the valve open there, the right side of the heart. The blood rushes from the atrium into the ventricle. Then this part of the heart contracts. Contracts and ejects this blood upwards. The blood can only go that way because this valve snaps shut. The moment that the ventricle contracts, the valve snaps shut, and the blood has to go out through this pulmonary artery towards the lungs and head. It can't go back where it came from, because there's a valve there that allows the blood only to go one way. So, as this first chamber filled with blood, venous blood, blue blood from the body, it contracted, forced this valve open and filled this chamber. Then when this muscle, which is much larger, contracted, there's the heart wall, and that muscle contracted, this valve snapped shut. You can hear it snap shut when you listen to it with the auscultation. So the blood is shot through another valve in the pulmonary artery towards the lungs. So that's the motion on the right-hand side of the heart, 2 chambers, the right atrium, the right ventricle, which follow in quick succession of contractions. Blood comes back from the lungs now, and it comes back here into the into the left atrium there. Note it's oxygenated now. It's in the left side of the heart where all oxygenated blood is. Again, the moment it fills this wall of the heart around the left atrium, contracts, pushes a valve open in the left side of the heart and fills this chamber here, known as the left ventricle. And it has the largest muscle of all. Here what? There's the muscle of the heart. It has the largest muscle of all. The purpose is that when this blood is ejected through a huge artery, can't quite get it in there, a huge artery called the aorta, it's ejected under tremendous pressure. That's why the heart muscle is so thick there. It's to squeeze the blood, to give it a tremendous spurt, as it were. The blood is forced through this tube or artery called the aorta, called the bridge of life. It's forced through this aorta. The aorta has got elastic in its walls, so it's squeezing back on the blood. There's the heart muscle forcing the blood into the aorta, and the aorta squeezing back on it. The result is that we get a pressure, a tremendous pressure. Pressure goes in here, in this aorta, to a normal person, round about, say, 120 milligrams of mercury. When the beat is over, the blood pressure drops before the next beat comes, and we get what is known as diastolic pressure, which is 90, say. Well, all right, 90 is all right. So we say 120 over 90 is that person's blood pressure. 90 represents a column of mercury that could be forced up by the pressure of the blood to a height of 90 millimeters and so on. So we talk about 120 over 90 being the pressure of the blood, varying from 90 to 120 between strokes. And this is the site of motivating the circulation. We can feel the pressure wave of this blood as it comes out of the heart down into the arteries. We felt the radial pulse on the wrist a little earlier. This is the way the heart works. Now, the next thing that we have to understand is what makes the heart pump? What makes it pump? How is the timing mechanism organized in the heart? So we'll go back again to our drawing, which is quite simple. 4 chambers being represented there again as the 4 chambers of the heart. Now, the heart wall is made of muscle, which I drew in. We all know that muscle contracts. If you give a piece of muscle an electric shock, or give it a nerve supply or a nerve stimulus, when a nerve stimulus is given to a muscle, it shortens its length. A good example is the biceps. The biceps lie on the humerus, like that, and they are inserted into the radius and ulnar bone, like that. And when we brace or when we contract our biceps muscle, the muscle turns into a ball-like structure. It shortens like that, and the arm is flexed. Now, this contraction of muscle is something we all understand, but in what we call movement. But we have to understand that heart muscle does the same sort of thing, with reservations, with slightly different features to it. The heart muscle changes its length, the length of its fibers, under stimulation, electrical stimulation. Now, we move our arms voluntarily. The heart muscle contracts involuntarily. Sometimes we can affect the rate at which it contracts. If we're emotionally upset and we're scared, then the sympathetic influence on the heart is to make it go faster. If we take a deep breath, then we make the heart go slower. There are things that can affect the rate of the heart. Where does the electrical activity of the heart come from? It comes from a little patch of nerve tissue here called the sinus node. The sinus node. And this lies in the right atrium of the heart. There, the sinus node. There's a place which is highly excitable, electrically excitable. It's the place where man is anchored to the anima mundi of the earth, the etheric body of the earth, and is anchored to it there. Man is related to the planetary logos through this input of energy through the sinus node. The heart muscle itself is excitable on its own, but normally comes under the hegemony of the electrical impulses that well out of this little node of tissue, sinus node. From the sinus node, there is a tract of nerve tissue called the Purkinje fibers. The Purkinje fibers, you don't have to remember that name, which travel down the septum that divides the ventricles from the atria. That divides the right heart side of the heart from the left. And the result is we have a nerve conducting tissue passing right the way through the heart, like that. And from the sinus node, waves of excitation come. Waves of excitation pass down through this electrical system of Purkinje fibers. And these electrical impulses cause the heart muscles to contract. First of all, the first ones to be reached are the 2 atria, and therefore you get this part of the heart contracting first, and then you get the lower part, or the ventricles, contracting next. And so the 2 atria contract first. The right atrium squirts its blood into the right ventricle. The left atrium squirts its blood into the left ventricle. That happens first, and then this action like that. And it's caused, the muscle contracts under the stimulus of waves of excitation emerging from the sinus node. Now, the rate at which the heart contracts is fairly steady. It contracts roughly between, say, 68 and 72 beats per minute. That is monitored or dictated to by electrical waves coming from the sinus node. Now, placed here in the wall of the right atrium are nerves which can make that rate change, nerves that can make the rate change. Sympathetic nerves will make it go up. Vagus nerves will make it go down. The vagus nerve is the most sacred tissue in the human body. The vagus nerve is the psychic aerial of the body. It is an extremely important nerve from an esoteric point of view. We will deal with that when we come to the nervous systems later on. So here we have a region of the heart which sends out a wave of excitation. We have sympathetic nerves coming to the heart from what we call the superior cervical ganglion. There they are. Sympathetic nerves which accelerate the heart. Sympathetic nerves accelerate the heart. And in meditation, in all our esoteric work, we are taught to reduce the effects of the sympathetic nervous system. The sympathetic nervous system anchors man in the world through its humoral materials. It anchors man to enmeshment. That's what it amounts to. It is a system we'll describe later on. So we're concerned here merely about the rate at which the heart is beating. The vagus nerve, two tracts coming down from the neck, also arrive in this region, and they slow the heart down. Vagus nerve slows the heart down. Now that is all you really need to know about the heart and the blood system. And now we can begin to look at one or two features which point to what we call pathology of the heart and blood system, the pathology of the heart and blood system. The first thing that we need to understand, though, is the blood supply to the heart. You saw all that muscle. That muscle has to have a blood supply. And the blood supply to it comes from the coronary arteries. When that blood supply fails, we get coronary disease, coronary disorders, cardiac conditions. So let's very quickly, before we consider the pathology of the heart, consider for a moment the blood supply to the heart. Here we have, if we were looking at the heart, here we have a picture showing the right side of the heart. If we were to look into the open chest, left side of the heart, and coming out of the heart is this huge aorta from the left side, which turns around and descends into the abdomen through the diaphragm, divides into the legs, pelvis, and so on. So that's characteristic drawing. Now, from this huge blood vessel called the aorta, there comes the blood supply to the heart. The very first arteries that are given off with the most oxygenated blood are the coronary arteries. A right coronary artery and a left coronary artery. A right coronary artery and a left coronary artery. And if I take this region here and magnify it, and there is the aorta, and there is the right coronary artery coming off it, the aorta, there's the left coronary artery. And these blood vessels feed the heart muscle. There they are, the right and left coronary arteries. They are absolutely life-giving. Cardiac muscle has to contract without without any failure, 72 times a minute, day in and day out, year in and year out. Millions of contractions. It has to have an adequate blood supply. It gets it from the right and left coronary arteries. And with this sort of background, we can now consider some of the disease conditions and some of their esoteric aspects. The first one I want to talk about is the pain of angina pectoris, anginal pain. And anginal pain occurs when the heart muscle is not getting enough blood supply. If the coronary arteries that I have just drawn here, if the coronary arteries are affected in any way, if they are narrowed, if they go into spasm, if they become aged and sclerotic, if a piece of material lodges in them from another part of the body, then you get a diminished flow of blood and oxygen to the heart muscle. And immediately the individual will experience pain. On the other hand, person may have a very poor blood supply to the heart, and if he exercises and requires a lot of oxygen, then he'll feel pain again. And this is known as anginal pain, pain of angina pectoris. This is because the heart, as it were, is insufficiently supplied with blood. The muscle of the heart, when it is insufficiently supplied with blood, secretes a histamine-like material, and this causes the pain. The pain of angina pectoris is referred to other parts of the body, not felt in the heart, but referred to other parts. It is almost always the left arm, the neck, throat, and the lower jaw. So when you talk about ischemic heart disease, by that we mean a reduction in the oxygen supply to heart muscle, you get referred pain. The patient comes to you with pain in the left arm, or pain that radiates up into the neck and the lower jaw, then he has almost certainly got an ischemic heart. By that we mean the heart muscle is not getting enough oxygen, and he should be referred to a doctor. Have that side of it done first. Then you may then you may do your esoteric healing. And so wherever you have a load placed on the heart more than the oxygen supply to the heart muscle, you get anginal pain. So that's something that is important for you to understand. In my book, Esoteric Healing, I have gone into the subject of arteriosclerosis, which is what every one of us in the room is suffering from. As we get older, we suffer from hardening of the arteries. What happens is this, that in the walls of the arteries, we get deposition of fatty material in the wall, and the fatty material attracts calcium, and we get calcium plaques, pieces of calcium material forming plaques, that's right, in the wall of the artery. And these plaques can, as it were, diminish the blood flow in the artery, diminishes the blood flow. Or the wall of the artery can split. The wall of the artery can split through this sclerosis, as we call it. And all this tends to narrow the lumen of the artery, reduce the flow of blood through the artery. This is one of the conditions which is attendant on old age. Sometimes it occurs very, very early in a person's life, when the blood supply to the brain is reduced tremendously. When the blood supply to the brain is reduced tremendously, the nerve tissue of the brain is destroyed progressively. You get softening of the brain. Early dementia. By that we mean that the person is unable to remember things, and because of the poor blood supply, and is unable to function with any sort of sustained mental effort. Senile dementia is when the process occurs naturally with old age, narrowing of the walls of the arteries in old age, constant flaring up of them, if you wish. So we're beginning to get some idea now about the various conditions arising from the blood system. Another condition which you're likely to meet, where you get narrowing of the blood vessels, is what we call intermittent claudication. Person walks 100 feet or so and then begins to get pain in his leg, and he finds that he must rest. Walk a little way and then he'll get pain in his leg again. The reason for this is that somewhere in the leg, the femoral artery probably, or one of the arteries in the leg, has become narrowed somewhere, and the amount of blood getting through the artery to the muscles in the leg is reduced, and there is this pain of intermittent claudication, indicating that the person's blood supply to the leg has been greatly reduced, could be by any cause. Then we come to the subject of heart block. And heart block We can understand heart block when we go to our picture of the heart and its innervation. You remember what I told you a little earlier, that there is a bundle of nerve tissue that flows from the sinus node all round the heart. Now, if the person suffers from a sudden diminishment of blood supply to this region here, then that nerve flow, that nerve current won't go down, won't pass down the Purkinje fibers. All sorts of things can stop the flow of this current. Such things as infections, such things as excessive stimulation of the vagus nerve, excessive stimulation of the vagus nerve. Let me tell you that I have known at least 3 examples in my life of men, they were all men, who had practiced hatha yoga and had developed, in fact, damaging effects from the exercises that they were doing. And the effect that I'm going to discuss in a moment was atrial fibrillation. The heart, instead of beating properly, fibrillates. And we'll talk about that in a moment. And it's extremely unwise to go plunging into hatha yoga exercises without being absolutely sure that there is no weakness in the heart muscle. How can you tell that? Only by very, very careful tests. And the very fact that many yogis, in controlling their heart action, go into fibrillation is indicative of what I mean. Sometimes you are told that the heart has stopped beating. The heart does stop pumping blood in fibrillation, but it is something often induced by a yogi. He says he's stopping his heart. In fact, the heart is not, it isn't that it's not pumping, it's pumping so fast that nothing's coming out. So we have to remember this. Heart block, then, is an interruption of the flow of electrical citation down into the I'm just remembering, in fact, a very close friend of mine who suffered from heart block. And the heart block was caused by a coronary that he had. In fact, he died, and he was brought back by surgery, brought back to life. And he's alive today and very well. But he occasionally suffers from heart block. What happens is that the flow of impulses down here is stopped somewhere down here. And this part of the heart goes on contracting. The atria contract. But the ventricles, the important part of the heart, sends blood out under pressure. The ventricles stop for about 7 seconds. They're without blood supply to the brain for 7 seconds. And they can fall down, just senseless. The brain loses consciousness. Or they may survive it, and then the ventricles start to contract on their own. And the ventricles then, under heart block, will, instead of beating at 72, they'll beat about 15 times a minute. Anything from 15 to 40 times a minute. Quite separately from the atria there. Obviously, you're not going to play around with heart block patients. You should recognize when you have got such an individual and, of course, have him properly medically examined. Now we come to the subject of fibrillation. Now, ventricular fibrillation is dangerous. By that we mean that the firing mechanism, the electrical stimulation of the heart muscle, as I've described it, goes haywire. It goes absolutely haywire, and instead of the waves coming regularly, they come from all directions and at all different times. And this is usually the condition that results from a coronary infarct, or if you like, a heart attack. Now, what is a heart attack? Well, we can see quite easily what it is from the knowledge that we have gained so far. Here we have a heart, and here we have the left coronary and the right coronary arteries supplying the surface of the heart with blood. Something passes around the blood system and into the heart, a piece of material, a piece of calcium, a piece of diseased tissue, and the piece of material flows into the coronary arteries and gets stuck there. The result is that this part of the heart supplied by that coronary vessel gets no oxygen, and it dies. And that is known as an infarct, I-N-F-A-R-C-T, and it causes a heart attack. The heart goes into fibrillation. By that we mean the two ventricles here are in a state of shock. They beat very, very fast, so fast that in fact no blood comes out of them at all. They are just quivering like that. A third of heart attacks lead to fibrillation and death. If the fibrillation cannot be corrected and the heart made to pump, or rather to beat at its proper rate, the patient dies within a few minutes. And that is a very frequent occurrence. What is required in this condition when a person has had a heart attack and the heart is in fibrillation is to have a defibrillator applied to the heart. By that we mean 2 electrodes of an ordinary 60-cycle current can be applied to the heart muscle and discharged, and the moment that happens it causes all the heart muscle fibers to go into a refractory condition. They can't be stimulated. So whereas they were resting and firing before all over the place, suddenly this electric shock makes them go all into a refractory state, and then they start to beat their normal rhythm again. And that is known as defibrillation, and it means getting the patient to the hospital very quickly. Well, you can't always get a patient to a defibrillator very quickly, and what has been done in the past is to press on the patient's chest wall, the wall of the chest, in such a way as to cause the heart to contract and to push blood to his brain and around the body. And people have been known to maintain this for some considerable length of time until the patient has reached a hospital and a defibrillator and so on. A heart attack, of course, is something that you cannot deal with esoterically, with esoteric healing, but you can deal with the aftermath of heart attack. You can deal with the person when they have this weakened heart. We say weakened because you have to remember that this part of the heart is now dead and it forms a scar. If you were taking the heart muscle, that part of the heart there, you would find there was healthy muscle, and just that's the healthy part that I've drawn, the healthy muscle, and then this part here is the part that has died, and all the muscle has died, and there's a scar there on the wall. And then there's healthy tissue again. That's that part there. So the heart wall is filled with scarred material. Usually, 2 out of 3 cases, the person survives the heart attack, and they have to live with a weakened heart wall. They may have another infarct, and another part of the heart is again destroyed. Another part of the heart is destroyed, and all the time the capacity of the heart to pump, to beat against the demands made on it has been reduced. And these people have to lead a very, very calm, relaxed sort of existence, or they soon become prone to a death-dealing heart attack subsequent to that. I want to talk very quickly about the subject of anemia. the question arises, where are the red blood cells formed? The red blood cells formed. They are formed in the marrow of the short bones of the body. The marrow of the short bones of the body. In the diploe of the skull bones, the red cells are formed in the marrow of the skull, in the ribs, in the vertebra, and in fact any bones which are not what we call the long bones of the limb. Here is a typical long bone known as the femur. The femur is the femur. Now that is a long bone. As you know, marrow exists as a fatty material inside the bones, and it is this part of the bone that can produce red cells. Normally the red cells are made in those bones that I've talked about, and so we'll colour them in red. But if the person suffers a hemorrhage, if he loses a lot of blood, then the yellow marrow in the long bones becomes red, and it produces red blood cells and replaces the loss. And it can do this in 2 or 3 weeks. And so this is the site of what we call hemopoiesis. Now, occasionally anemia occurs. If there is blood loss, especially in women, you always watch out more carefully with women, because they lose a certain amount of blood every month under natural conditions. Also, women are much more careless, they are in England anyway, about their nutrition than men are, especially young girls. Young girls who work in factories and are having periods, perhaps heavy periods, are victims of anemia. They tend to live on cups of coffee and bread and butter and don't bother about green vegetables. They share an apartment with somebody and eat poorly, spend their money on their boyfriends. And the other candidate is, of course, old people, elderly people who can't afford or can't be bothered or just can't get out to get the right sort of food. People who prefer to live on carbohydrates instead of proteins. People who are unable to replace the iron in their bodies. Now, many conditions can cause anemia apart from hemorrhage. One of the conditions is lack of iron or loss of blood containing iron so that the iron is not replaced. This causes the red cells, instead of forming as I have described them, the red cells come out with nuclei from the bone marrow. Come out from the bone marrow with nuclei, and they're inefficient. And so a lot of the red cells are what we call pronormoblasts. They are not efficient and can't carry sufficient oxygen. Then we have the condition known as where are we now? Condition known as what's the one with the intrinsic factor? Pernicious anemia. Pernicious anemia. It used to be a terrible scourge once, but it's not nearly so much a scourge now because we know what causes pernicious anemia. Pernicious anemia is caused through the inability of the body to absorb vitamin B12 and folic acid. The inability of the body to absorb these 2 vitamins or these materials. In other words, the person eats food which comes down into the stomach here, and the stomach fails to produce what is called an intrinsic factor. The intrinsic factor ensures that these materials are not destroyed by digestion and ensures that they are absorbed into the body. When we lack an intrinsic factor in the gastric surface or mucosa, then these materials can't be absorbed into the blood, and the result is that the marrow fails and we suffer from pernicious anemia. Should always remember that the flora of the gut, the bacteria in your gut, vary in many instances are helpful to the body. For instance, vitamin B12 and folic acid are produced when food is acted upon by bacteria, and these bacteria release the material and it can be absorbed. So then we get other varieties of anemia, which I don't have to discuss with you tonight. It can be caused by drugs. The taking of certain drugs can destroy the bone marrow where the blood cells are made, and we call this aplastic anemia. Aplastic anemia. A certain drug some time ago caused a tremendous amount of aplastic anemia, and to this day any known drugs produce the aplastic condition. Well, ladies and gentlemen, I think that we can end there. Tomorrow night I'd like to start off with inflammation. What inflammation is. I'll do varicose veins, I'll do the lymphatic system, and I'll go on with my program.